Hello, my name is Gabrielle Alsop, and I'm a certified family nurse practitioner serving the Las Cruces, New Mexico area. I work for a federally qualified health center who serves a large population who face many healthcare disparities. We are able to provide primary care services despite anybody's ability to pay. I became a nurse practitioner because I wanted to help make a difference in people's lives. Along with this calling, though, my passion resides in health, fitness, and nutrition. As my practice continues on, I've become more aware of what my patients' needs are and what our community obstacles are facing. One issue that I see in our community, as well as nationwide, is obesity. Obesity is the second leading cause of preventable death in the U.S. and accounts for more than 300,000 annual deaths a year. In 2006, more than $147 billion were spent on obesity-related costs. This number is only anticipated to increase at least by $44 to $66 billion by the year 2030 if something is not done. Obesity rates here in New Mexico are 32.3%, while the U.S. obesity rates are topping at 42.2%. These rates are getting further and further away from the Healthy People 2020 goals, which sets obesity rates at 30.5%. The reason why this is a concern for New Mexicans is because obesity is affecting those minorities and those at a socioeconomic disadvantage, which accounts for 38% of our New Mexicans due to the federal poverty levels. New Mexico had the second highest poverty rate in the U.S. in 2017. These higher poverty rates lead to decreased access to healthy foods, decreased health care, more reliance on Medicaid coverage, or no health care insurance at all. Medicaid is a big insurer in New Mexico, which accounts for 34% of New Mexican population. In addition to, in 2006, 11.8% of Medicaid spending was spent on obesity-related issues. As a provider, I have seen firsthand what obesity does to my patients' overall health, which increases their risk for type 2 diabetes, heart disease, cardiovascular disease, and cancers. Not only does it affect someone physically, but it also affects them mentally and emotionally as well. Most obese people also fight issues with anxiety and depression, and unless those conditions are treated as well, could lead to loss of life by suicide. My recommendation for this change is to ensure that New Mexicans are given access to preventative services for nutrition and dietary counseling for obesity. With this increased access to nutritional counseling, you are giving New Mexicans a way to change their lives. The problem with Medicaid coverage right now is that restrictions are in place which are excluding many of the eligible patients from receiving these services. This education, this knowledge is what's going to make a difference in the long-term results. Prescribing 12-week diets does not work. Telling someone to exercise is not the answer. These have been tried in the past and, as you can see, are not working. We need to educate someone on how to make and choose healthy choices in this fast-paced lifestyle that we live in today. Delicious, inexpensive, high sugar, high fat, high caloric foods are everywhere, and they will always be around. However, it is the decisions that we make daily that equal lifelong change. We simply cannot tell people to avoid fast food or to stop having dessert with dinner. We need to teach them how to make better life choices for long-term health. I feel like allowing New Mexicans the full covered access to these types of services without having limitations is the key to help New Mexico get back on track to help reach those Healthy People 2020 goals and decrease the rates of obesity. I am so passionate about helping create change for New Mexico for the healthier lifestyles, but in order to do that, I need your support to help create change. Thank you.